Welcome to the Breathe Easy, Breathe Well virtual event. As a reminder, this presentation is for informational purposes only and neither to replace the advice of your physician nor intended to diagnose, treat, or cure your condition. Today we have Dina Sanitza with us. Dina is a breathing coach and certified Buteyko practitioner. She is the founder of the Breathe Clinic in Auckland, New Zealand. She helps people with chronic hyperventilation, which usually manifests as asthma, hay fever, allergies, insomnia, snoring, sleep apnea, chronic fatigue, anxiety, and stress. She does this by taking her clients through the Buteyko method of breathing, retraining whether online or in person, and helps bring their day-to-day breathing back on track and allows them to breathe easier, sleep deeper, and be calmer. Her mission and passion is to help people breathe their way to better health, peak performance, and meaningful lives. Chronic hyperventilation syndrome is often missed. It is an insidious condition that rears its head down the line when it has worsened to the degree of triggering symptoms and causing chronic health problems. Dina will be talking about how to recognize this condition, what first steps to take to bring your breathing back on track, and how you can effectively correct this condition using a proven and strategic method. Welcome, Dina. Thank you so much for joining us today.
Thanks for having me, Dawn.
Absolutely. So today, Dina is going to discuss what chronic hyperventilation is and how it affects us. Dina, can you tell us a little bit about your background and how did you get interested in chronic hyperventilation syndrome?
I was actually a patient or a client first. Around 8 years ago, my asthma turned for the worse. So it was a severe exacerbation. Monthly, I had lung infections that needed antibiotics. And I was walking like an old lady, shuffling, bent over, short of breath, couldn't catch my breath. And it came to the point that I was hospitalized twice in 1 week because of really severe exacerbations. So it just made me think there must be something more to this. I was on a cocktail of steroids, inhaled steroids, the blue inhaler, antihistamines, and a nasal spray. And I thought, oh, there must be something more. I mean, not only drugs, because I was already on maximum dose and I was still not improving. So I went to a second GP another GP for a second opinion. And he was the one who picked up. He said, you were sighing 15 times in 15 minutes in my clinic. In the 15 minutes I was there. He says, you really have a breathing problem. So he made me go to this TACO course, which I was quite skeptical about because there were so many things that you run into and you go, oh, what does this do? And things like that. So I was at the back. I was in medical school for 5 years. I'm not a doctor, but I left medical school and I realized I don't think I'm cut out for the stress that the profession, being a doctor will face.
Yeah.
So anyway, I left medical school and went to do a master's in education. So I was at the back thinking this better make sense and trying to recall everything I learned in physiology. And it totally made sense. Within the first week, I dropped 3 of my 4 medicines. Wow. And within 9 months from the course, with the help of my doctor, I was able to taper off the last remaining medication, which was my steroid inhaler. And I was safely able to taper it off. And I have been how do you say, medicine free.
Yes.
For the past 8 years.
Wow.
Because of that. So anyway, with that, and then I have 8 children and all of them went through it because they all have some form of asthma or hay fever. My husband the same, and he snores as well. And my parents, all of them went through the program. Everyone had good results. And I thought there's something in here. And I want to do this. I want to share it with a lot of people. So that's when I decided to train as a Buteyko practitioner.
Awesome.
Yeah.
So what can you tell us about chronic hyperventilation syndrome? What exactly is it?
Chronic hyperventilation, I'd like to differentiate it from the usual image that when we hear hyperventilation, most people will have this image of someone in a panic attack, right? The big breaths and the very visible. And That is hyperventilation, yes, but that's acute hyperventilation attack. Now, chronic hyperventilation is a little bit more subtle. You don't really see it very much, and only a trained eye would be able to pick it up that someone has chronic hyperventilation. Now, in one word, all it means is overbreathing. So you're breathing more air than your body needs. In the same way that eating is good and overeating is not good, breathing is good for us, but overbreathing is not good. So there's an increase in volume, breathing volume. There's an increase in breathing rate, and there's predominantly upper chest breathing, and the breathing is irregular with a lot of either sighing, yawning, coughing, throat clearing, sniffing, and breath holds, and the tendency to mouth breathe. So that's the usual picture of chronic hyperventilation.
Okay. And how exactly does chronic hyperventilation develop?
It's in anything. Stress. It's not anymore surprising to us, right? It's stress. Right. But when I say stress, the usual thing that comes to mind, again, for most of us, is mental and emotional stress. Yes, that's part of it, mental, emotional stress. But there's also physical stressors like accidents, illnesses, whether it's an acute illness that's intense or a chronic illness, so long-term illness. And there's also chemical stress, which is exposure to pollutants, or even just our personal care products, home cleaning products. So anything chemical that's in and around us can affect us. So the body tries to achieve homeostasis. Right. Anything that the body needs to deal with in order to retain homeostasis and good health, that is a stressor. So exposure to stressors can cause the hyperventilation, because when the body tries to adapt and reach homeostasis, one of the tools that the body uses is the breathing. So you increase your breathing and then it goes back to baseline. Increase your breathing, goes back to baseline. So with anything, the whole day that's happening to you, breathing increases and it goes down. But when you come across a stressor that might be intense or prolonged, breathing increases, and on its way back down to baseline, it can get stuck. So now you're breathing a little bit more than your baseline, but you don't notice it and you don't feel anything because there's no immediate response from the body. It takes years and decades before that. It's going to affect your blood chemistry, your metabolism, but the effect will take years to develop. So that. And then what happens there? Sorry, this is a long winded answer, but because what the brain does when it's regulating your breathing is it's monitoring the CO2. Mm-hmm. And this is surprising to a lot of people because breathing is because of oxygen, right? We need the oxygen. True. But what the brain tries to keep an eye on is your CO2 levels in the blood. Mm-hmm. Too much of it, it tells you to breathe faster, so you get rid of it, go back to healthy levels. Too little of the CO2, it tells you to breathe slower, so you can keep some of it in and increase it to healthy levels again, and it makes then you're back to normal breathing. But when your breathing increases because it's stuck, what happens is now you're letting go of too much CO2 because you're either breathing bigger. When you breathe in big, you're also breathing out big. Mm-hmm. If you're breathing in fast, you're also breathing out the same number of in-breaths, right? Right. And so you're losing CO2. When you lose CO2, you also lose tolerance to CO2. Mm-hmm. And that causes a dysregulation of your breathing. And the next question that people usually ask me is, so what, Dina? I thought that's a waste gas. When I was in primary school, I remember distinctly learning that CO2 was a waste gas and that we had to exhale it. Mm-hmm. Well, we exhale some of it, but we need to retain some of it because, again, that's helping with regulation of breathing. Yeah. It also helps the smooth muscles to relax. And our tubes in the body, like blood vessels and airways and all that, they have smooth muscle around it. If you have good CO2 levels, they're relaxed and wide. If low CO2 levels, they constrict, the smooth muscles contract, and therefore the tubes constrict. So that if that's an airway, that results in the tightness in the chest. If that's a blood vessel, that will result in high blood pressure, poor circulation. So that's the other role of CO2. And then the other role is that CO2 helps deliver oxygen efficiently. Without enough CO2 in the blood, you may have breathed in the oxygen, and all of us are very good at that. We're very good at taking in the oxygen. But the next step, which is making sure that the oxygen that we've taken in is delivered to your tissues, that's where we're not very efficient in.
Yep.
And so with people who have lung problems like COPD, they can still have comfortable breathing as long as they're efficiently delivering the oxygen. But you need CO2, you need good levels of CO2 in order to do that. And also, CO2 helps reduce inflammation. So we know that chronic inflammation leads to chronic illness. And so it's really good to have a good level of CO2. So that's where the problems start to come around, when CO2 levels in the blood is lowered because of the hyperventilation.
Yeah, and I was going to mention that it's on our blood chemistry. You know, in the U.S. it's CO2. In at least most of Europe, it's COH, I believe. It's bicarbonate versus the CO2 because it's actually measuring more the bicarbonate than the CO2 itself. But that also leads us to C is a person in respiratory alkalosis or respiratory, yes, thank you, acidosis. So it's interesting that, you know, people are like, oh, it doesn't really matter about the CO2, but if it doesn't matter, it wouldn't be a primary marker on our blood chemistry. And I like that you're really going into depth with explaining why CO2 is so important to us. So what symptoms can alert you to a possible hyperventilation problem? I know you touched on that briefly, but can you go into a little bit more detail about that?
There are a lot, and there are symptoms that may not even be breathing related, and you'll be surprised that, oh, is that a hyperventilation symptom? So I've got a list here. I'm going to look down because I don't want to miss anything.
Yeah, no problem.
I've got a list of the more common symptoms. So chronic blocked or runny nose. So it can be either blocked nose or a runny nose. If you're easily short of breath, whether at rest or when you start moving around, let alone in exercise, right? Frequent dry mouth or throat, feeling like you're not able to get a satisfying breath. You take a big breath and you feel like, oh, that's not enough. Frequent sighing, yawning, which is my problem, right? With frequent sighing, yawning, throat clearing, and sniffing. Frequent colds or chronic cough, feeling dizzy or brain fog, anxiety and lowered stress tolerance, poor sleep, snoring, and sleep apnea, palpitations, that's really quite common, very fast heartbeat, chest pain that's not heart related. So usually, and this happened to me, I went to the ER because of chest pain and palpitations. They did an ECG and I was cleared, but they didn't tell me what was wrong. You know, good news is there's nothing wrong with your heart. But what was that? They didn't say anything. And then chronic tiredness is the other one, because if you're not delivering your oxygen to the tissues efficiently, then you're not able to produce energy.
So what about memory issues? Would that also be something that comes into that scenario?
Yeah. The brain fog. So the brain fog will be like poor memory, difficulty learning, difficulty retaining information. Yeah, and anything that's the executive function of the brain will be dampened because there's less blood flow.
Okay. All right. Perfect. And what conditions commonly result from hyperventilation syndrome?
So the usual ones are asthma, hay fever, and allergies. So that's one category. And another one is the sleep category, which would include insomnia, snoring, and sleep apnea. Then there's chronic fatigue, anxiety and panic attacks, and lowered stress tolerance, high blood pressure. There's quite a lot, but those are the more common ones. And now, I'd like to say that other chronic respiratory conditions, such as emphysema or COPD, will also benefit from a more efficient delivery of oxygen because we actually, for our day-to-day life, we actually just need like an eighth of our full lung capacity.
Mhm.
So even if there's some injury or scarring, or let's say a tenth or a quarter, you still you still have enough, because if you only need an eighth to do day-to-day activities, then that's good enough. But why is it that they are having such difficulty breathing when they have these conditions? Is that they're not delivering the oxygen efficiently. Once they learn, so when my clients learn how to breathe efficiently, they feel much, much better. I have clients who wanted to start walking again, tramping, and she
Mhm.
was able to, and she had emphysema and COPD. Just able to go for walks again with her husband. So that was really, really good.
Yeah, that absolutely is. I know that, as a person who suffers from asthma and bronchitis, just sometimes being able to get from like the sofa to the kitchen is, a difficult task. And so when that becomes a chronic thing, when you finally can breathe and you get to do something that's like a normal everyday activity, like walk the dog, it's like you feel free, you feel liberated. And
Definitely.
it completely changes your quality of life, which then in turn changes your mental health, because when you're going through day to day and you don't function optimally, it really starts to wear on you. And
Definitely.
I have experienced that personally, especially after living here in Italy. Yeah.
Yeah, I remember being scared to go out with my family to go for a walk or to go to the park, because
Hmm.
I'm thinking, are there steps? Is the track, inclined? So it was
Yeah.
always something that I needed to think about and
Yes.
fear.
Yes.
So,
Every time my husband would, even throughout the 2 years prior to that, oh, we're gonna go on a walk somewhere. I'm like, please be no
I
hills,
heard,
please be no steps. Because
I know,
I wanted to experience everything with him. I wanted to get out and experience
of
Italy.
course.
However, I also felt like, how do I get to experience this when I'm in my brain? I'm thinking, how close is a hospital?
Yeah,
Yeah.
I know. Oh, exactly, exactly.
So, how do you help your clients overcome hyperventilation syndrome?
So I take them through a course called the Breathe Buteyko course. So Buteyko is a Russian doctor in the 1950s,
Hmm.
where he developed this method after observing that people in the hospital who were really sick breathed in a certain way, and people who were not very sick breathed quite differently, and people who were well definitely breathed a different way.
Hmm.
So he was thinking, and he had morbid high blood pressure, and his own doctor was telling him, if you don't address this, you could die very
Right.
soon, in 6 months or something like that. And he was his own guinea pig. So he said, what if he postulated, what if I get my breathing from this, because his breathing was similar to the sick people, to the kind of breathing that well people do. And so he did that, and he got better. He was able to manage his high blood pressure. So the funny thing is that this program was initially done for high blood pressure, and so it worked, and he's developed this. So I take my clients through a Breathe Buteyko course, where the main focus is to really get their day-to-day breathing, their automatic day-to-day breathing, back on track.
Hmm.
And a lot of people don't understand that, because sometimes some people kid me and say, oh, I've been breathing since I was born. Why would I need someone to teach me how to breathe?
Yeah.
That's true. We breathe, and we must be fine because we're still breathing. But what most people don't realize is breathing can go off track. We can develop poor breathing habits. Now, when we do that, we go farther and farther away from health when we have poor breathing habits. So what needs to happen is we need to unlearn the poor breathing habits and relearn good breathing habits. And when we do that, most of whatever symptoms you have that are breathing related, if the cause of that symptom is breathing related, then they resolve once you've corrected your day-to-day breathing. So this is not the I'll teach you breathing exercise to do when.
Mm-hmm.
No, because that would be stopgap. That would be band-aid. So this is, we will teach your body how to breathe well day to day, so you don't even need any band-aid.
Yeah, I think it's important to understand that because breathing is automatic, it's second nature, that when we start to go to school or we start playing sports and we're in doing exercises or things that are chronic, like we're all the time standing or we're all the time sitting, it starts to change your posture, therefore starting to change your ability to breathe the way you did when you were born, which was a very natural function, right? And
Right.
so it's still second nature, it's still a natural function, but we, as you mentioned, may not be breathing optimally. And that lack of breathing optimally is leading to other chronic conditions.
Exactly. Yes.
Yeah.
Now, usually, yeah. So usually people who work with me opt to do a breathing assessment because people who know, they say they've been told they have hyperventilation and they're keen to really do something that's strategic and that's focused, then they get on the course. But some people, they're not very sure yet. They go, I'm not sure if this is breathing related. I wonder if it's really, or what will this do for me? And they come for an assessment. So in the assessment, they get the information about their breathing. I get to tell them what their breathing is like compared to healthy functional breathing.
Mm-hmm.
And then, yes, and then we relate it to their condition and their symptoms. And they go, oh, so that explains it. So they get clarity on what's happening in their body and why their body's reacting this way.
Yeah.
So, yeah.
So, what tips can you give us to start getting our breathing back on track?
Okay, we'll start with relaxing. So that's for any breathing retraining to happen, the body needs to remember how to relax. So that's the first thing. And a good way to start this is make a list of everything that you enjoy and that makes you relax, and try to do one thing every day. Not even thinking of your breathing, just relaxing. Just that would be the first focus. Trying to help my body relax, my mind and my body. I think both of them. And then the second thing is to keep your lips together all the time. So breathing in and out through your nose. Because whenever your lips are apart, even if it's just partial, so some people might have an open mouth posture like that. As long as that the lips are apart, then the air will be coming in through the mouth because of the greater suction, right? Mm-hmm. So lips together is the second one. The third is to avoid big breaths. You know, when maybe you might be doing a meditation or a yoga exercise and they tell you, okay, now take 3 deep breaths, and they go, but you see, deep is depth. Shallow, deep is all the way down here with no movement there. It's not size. Deep is not a word for size. So small and big, small and big. So I would show. I can't show you right now because it's because of the camera, but I show my clients who are in front of me that I would breathe deep but small. So it's all the way down there, but hardly seen, as if you're not breathing at all. So yes, so from at least that's the third one, is to avoid big breaths, sighing, or yawning. So remember, you want your CO2 back. You've lost a lot of CO2. You want to retrain your brain to be more tolerant to CO2 again. So you're like a miser thinking, CO2 is gold, CO2, CO2. You don't want to let it go. And then maybe have your breathing assessed. If you're suspecting that might be a cause of your condition, or at least a contributing factor to your condition, it would be good to have your breathing assessed. Because even if, so say if I had gone with my asthma, if I had gone to other very good natural modalities, and I have, because I use a lot of different modalities to keep me healthy, but not change the way I breathe, this would help to a certain extent, but this will keep me in hyperventilation still. Mm-hmm. And so the other modalities will be struggling to get the inflammation down, right, to, do all the good things that they do.
Right.
But this will keep me in my condition because I haven't changed the habits. So yeah, so that would be something to look into if you really want to get a handle on the breathing, your breathing issues.
So you mentioned earlier that sometimes it takes years or even decades before you actually notice, or even maybe a physician would notice that you suffer from chronic hyperventilation syndrome. How is there a way to figure it out earlier? Like, I mean, if somebody's going decades without breathing well, we're talking about they probably already have hypertension, they probably
Mhm.
already have sleep apnea, they might
Yeah.
have shortness of breath when they're walking up and down the stairs, and they're just thinking, oh, I'm getting older. Because so many physicians are like, oh, you're just older. That's what happens when you get old. How is there a way, or is there a way that we can try and identify this earlier?
Yes. But first, before I answer that, I'm going to tell you that's my pet peeve.
Okay.
I don't like the, I don't like them saying you're just getting older because
Yeah, I hate
today
that.
I'm around 10 years older than, yeah, 10 years ago, but 10 years ago I was not healthy and I had so many problems
Mm-hmm.
and I couldn't walk without being short of breath and all these things. Now I'm doing so much more.
Mm-hmm.
So I tell my clients, don't excuse when your body tries to tell you something because there's an ache or a pain or a difficulty, it's your body trying to tell you there's something amiss.
Mm-hmm.
Listen to your body and try to find out what's wrong. It's easy to excuse, I'm just getting old, but that would mean you're not going to try to look for the cause, right? But yeah, very good question. Okay, so how to pick it up earlier? Well, for the viewer, for you who are viewing this video, with the symptoms that I have listed and the conditions that I have also mentioned, then you would now be able to pick it up. And hopefully it's still at early stage. But don't worry, even if it's been years, mine was years and it's still resolved. So yes, but definitely the earlier you pick it up, the better. Now my freebie is an ebook where included in the ebook is a quiz, a hyperventilation quiz where there will be some symptoms that you will rate, and at the end you will find out whether hyperventilation could be a factor in your condition. So if you get a certain score, then it's something worth looking into. So yes, educating yourself on what hyperventilation is and all that is good. So download the freebie to get that quiz.
Okay, awesome. Well, thank you. So if you could have one takeaway for our viewers today, what would it be?
I would say nose breathing. Nose breathe in and out through your nose all the time. That is the biggest thing, and that would make a shift already. It might not be the total change that you want, but at least by just trying to do that, be aware of trying to breathe through your nose all the time, you can notice some shifts. I do a challenge once in a while, a 5-day mouth breathing to nose breathing challenge, and the participants would tell me that now I'm sleeping a little better. Now I'm not sniffling as much, and so there is going to be some changes when you get to do that.
Absolutely. And for our viewers, is there a way for them to find out more information about you, or if you're taking on new clients, how can they find you?
You can find me through my website. It's www.thebreatheclinic.com, or Facebook. I'm more active on Facebook than any other. I'm also on LinkedIn, Dina Saniza, the breathing coach, or Instagram, the Breathe Clinic. But Facebook is where I am more active. It's the Breathe Clinic. Okay, so on Facebook, the Breathe Clinic, and
All
you'll
right.
find me there.
Perfect. Thank you. Well, thank you so much today, Dina. I really appreciate you coming on and sharing this. And I learned a lot. When I first started this, I didn't think of sleep apnea, for example, as a breathing condition. I thought of it as a sleep condition. But to think about it, it is a breathing condition because you stop breathing while you're sleeping. And so I really appreciate everything you shared with us today. And I know that I took away a lot. I know my viewers did too. Our viewers did. So again, thank you so much for today. I appreciate it.
You're welcome. It's my pleasure.
Absolutely.
All right.
To my viewers, I'll see you in the next interview.